On this segment of Health Matters, we're talking to Dr. Christy Gredinger, an OBGYN physician here at the University of Alabama Medical Center. It's good to see you.
Good to see you.
Thanks for joining
Mike.
us. You know what? Years ago, we wouldn't have this conversation because we didn't talk about such things as birth control. Isn't it a healthy thing that these days we can talk about just about anything dealing with the female birth control issues because it's so important? Isn't it good that we're more open about it now?
Absolutely. Family planning has changed a lot over the last 50 years.
My mother, for example, would never have talked about anything like this. In fact, she didn't even go to an OBGYN doctor because it just wasn't something you did unless you got sick. That's sad, really, in hindsight.
It is. And in fact, more than half of pregnancies in the United States are unplanned. And so it really is important that women talk to their healthcare provider about birth control options.
Today you're talking about a couple of different birth control options for women. We are familiar with things that have been used for decades and decades, and we've talked about the birth control pill a lot, but you're talking about a couple of other options today. What's the first one that you'd want our viewers, both men and women, to know about today?
Right. So the newer options are called LARC, long-acting reversible contraceptions. The LARC methods are divided into two types of devices. You have intrauterine devices, and these are a small T-shaped device that's inserted through the natural opening of the woman's womb. They last for 3, 5, or 10 years, depending on the type of IUD. There are hormonal IUDs, those are the 3 and 5 year type of IUD, and non-hormonal IUDs for women that can't take hormones.
And have they been used long enough? Have you used these long enough to have high confidence in them? I know the answer is yes, or you wouldn't be using them, but what is the chance of getting pregnant if a woman is using one of these?
Right. So some women may remember some of the original IUDs from the 1960s and 70s. The IUDs have evolved a lot from that standpoint. They're much smaller, they're more effective, they're easier to insert and to use.
And what patient would come to you and say, I don't want to take the birth control pill, we don't want to use other kinds of things that are kind of bothersome and trouble? Is this one of the things you recommend to women who come to see you?
Absolutely. A lot of women don't understand the benefits of intrauterine devices, or they might feel like they're not eligible for this type of device if they haven't had children before. And that's actually not true. These types of devices can be used in young women, older women who have had 1 or 2 children, and women who want to manage their menstrual cycle as well.
So there have been misconceptions about their use, and as you've already indicated, they've improved dramatically, both in how they're used, how reliable they are, and any other questions a woman has. We've made great advances here.
Absolutely. There's very few situations where a woman wouldn't be eligible for this type of birth control.
I guess this is a dumb guy question, but a woman doesn't have to insert this. This is done by a doctor.
By a healthcare
correct?
Provider, absolutely.
Is that a big deal? Do you have to put them to sleep? Is it painful, or is it kind of a quick,
this is an office
thing?
visit, and I typically say it'll last about 4 or 5 minutes. It might be a little bit crampy and unpleasant, but can be back to work or their usual activity usually that same day.
And back to normal sexual activity quickly
within
as well?
a few days.
Within
yes.
a few days, all
Absolutely.
right. We can see that one well on camera. Talk about the other that if I didn't know you were a credible physician, I'd go, you're making this up. That can't actually work. It's so small. Hold that out and
Sure.
tell us about that one.
Sure. So this is a contraceptive implant, and it's called Nexplanon. This is a 3-year device that's inserted in the arm. It lays between the skin layers and the muscle layer, and it is a non-dissolvable plastic implant. It's impregnated with a progesterone hormone, so it's highly effective. In fact, this method is almost as effective as permanent sterilization, like tubal ligation and vasectomy.
It wasn't that long ago that this type of thing, or even the IUD to describe, might not be good for that long. These time frames have changed a lot, haven't they?
That's right. Same with the IUD devices and the contraceptive implant. They can be reversed or removed at any time that you're ready to have children or you're not happy with the device. You just simply make an appointment with your doctor.
Repeat again, how long does this last?
3 years.
And so it must last a little longer than that in reality, but the 3-year time frame is what you tell your patients to feel comfortable with?
Excellent question. Actually, it lasts at least 4 years. There's been studies showing that extended use in the 4th year, there's essentially no pregnancies.
When you use this and it's put in the arm, is that done with local anesthetic? Do you just numb that area where it's going?
Yeah, all that's necessary is a local anesthetic, exactly.
Does it
No
start
incisions, no
Nothing.
stitches, no nothing.
You put it in fact, with a needle? Or do you,
Yes.
you don't have to cut their arm.
That's right. You put it in with a needle. It slides just right under the skin, similar to having an IV started, but I actually think it's much simpler than
And
that.
it's even simpler than giving blood because that needle's kind of big.
Yes, and that needle has to get precisely in the right place. Unlike
Right.
this, it can be just slid under the skin of the arm.
Good. And when does it begin working?
This begins working about 7 days after
Okay,
it's
so you
inserted.
wait about a week. Fascinating stuff, and I thank you for answering my guy questions. I'm not proficient in your area, but you are, and that's very valuable to our viewers, and we appreciate you joining us, Dr. Gradiner. Thank you so much.
Thank you.